This video will focus on the concepts of transference and countertransference in a therapeutic setting. Therapy centers on the relationship between the client and the therapist. Hamilton defines transference as carrying over irrational elements from past relationships, displaced onto the social worker, reflecting unconscious motivation. Transference is the technical term for the unconscious transfer of experiences from one interpersonal situation to another. Simply put, it is the redirection of a client's feelings from a significant person in their life to their therapist. For example, you might observe characteristics of your mother in your counselor. Another example is when a patient attaches anger, special love, adoration, or other feelings onto their therapist. There are different types of transference. Positive transference can be beneficial, leading to a positive outcome because the client views the therapist as caring, wise, and concerned about them. This can occur when enjoyable aspects of past relationships are applied to the relationship with the therapist. Negative transference involves the transfer of negative emotions to the therapist. Emotions like anger and hostility, possibly felt toward a parent or another important individual in childhood, reappear in the therapeutic relationship. Once realized, the therapist can use transference as a discussion topic to further examine the client's emotional response. Sexualized transference includes feelings of intimacy, reverence, or worship directed toward the therapist. Reasons for transference include loneliness and isolation, which may lead to the therapist becoming central in the client's life. Reduced opportunities for romantic interests can also be a factor contributing to transference. Individuals with borderline personality disorder or those with difficult interpersonal relationships who rapidly shift between loving and hating and see others as all good or all bad are also prone to transference. Clients with low self-worth might project feelings that the therapist is a good role model, leading to transference. Transference has its pros. When acknowledged, it can be a useful tool in therapy to uncover old trauma and problematic relationships. Subconsciously using transference may lead you to treat someone more compassionately if they remind you of another person or relationship. Conversely, a con of transference is that subconscious transference outside of therapy may negatively affect relationships, especially if the feelings originate from a bad past relationship. Without understanding and acknowledging transference, you may not be interacting with people as rationally as you perceive. Countertransference is the redirection of a therapist's feelings toward a client. It is the therapist's emotional entanglement. Therapists must be aware that their own feelings and internal conflicts could be transferred to the client. Countertransference can make it harder for a therapist to maintain objectivity during the therapeutic process. This can skew therapy, as actions might be based on the therapist's feelings rather than the patient's. Confused by the therapist's emotional response, patients may also struggle to resolve their issues. Reasons for countertransference include a client reminding the therapist of someone they have or had strong feelings for, feeling parental towards the client, or experiencing sexual attraction. Examples of countertransference behaviors include inappropriately disclosing personal information, lacking boundaries, developing strong romantic feelings, being overly supportive, or being overly critical of the client. In conclusion, therapists may intentionally use transference to better understand your perspective, or it can be unintended. Transference and countertransference can be barriers to achieving case goals. The goal of therapy is for you to feel comfortable having an honest dialogue with the expert. If transference impedes this, therapy will be ineffective, though sometimes it can aid treatment. Thank you for watching this video from Nier's Epigenetic Wellness. You can call us on 94464 6777779.